Did you know that nearly 55 million people around the world currently live with dementia, and that someone receives a new diagnosis every 3 seconds? Even more alarming, dementia has climbed to become the 7th leading cause of death worldwide. Yet most of us still believe that memory loss and other cognitive declines are inevitable parts of aging or inheritance. What we rarely hear is that many everyday medications, yes, the very pills sitting in your bathroom cabinet, can quietly accelerate brain shrinkage, speed memory loss, and even trigger the earliest stages of Alzheimer's disease. If you're over 60, the stakes are especially high. These drugs may be weakening your brain long before they ever help your symptoms. In this video, we'll expose 9 commonly prescribed medications with strong scientific links to dementia-like effects, and then share 3 naturally brain-protective foods you can start eating today. Make sure to stick around until the end. The number 1 culprit is shockingly widespread, and few people realize the danger it poses. Let's begin with one of the most innocuous-seeming categories. First-generation antihistamines, the ones you find in many over-the-counter allergy pills and nighttime cold remedies. Diphenhydramine, known by brand names like Benadryl, is a powerful anticholinergic. In plain English, that means it blocks the neurotransmitter acetylcholine, which plays a starring role in memory and learning. When seniors take these drugs daily for even a few months, their risk of developing dementia climbs by more than 50%, according to a JAMA internal medicine study. It often starts quietly. You might misplace your keys more often, or struggle to find a familiar word. Over time, that fog thickens, and brain scans reveal real atrophy. All because a harmless allergy pill has been blunting communication between your neurons. Next on the list are benzodiazepines, medications like Valium, Ativan, and Xanax, often prescribed for insomnia or anxiety. These drugs supercharge the brain's own brake pedal, GABA, to produce feelings of calm. But while a few doses can feel like relief, long-term use essentially sedates the cortex, slowing thought and memory formation. A large-scale BMJ study showed that taking benzodiazepines for more than 3 months raises Alzheimer's risk by over 50%. Patients may first notice an extra heavy sleepiness during the day, or feel that conversations slip right by them. Before long, daily mental tasks, from paying bills to remembering names, become frustratingly hard. Proton pump inhibitors, PPIs, are the third major culprit. Drugs such as Prilosec, Nexium, and Prevacid have revolutionized treatment for acid reflux, but they too come with cognitive costs. By dialing down stomach acid, they impair absorption of vitamin B12 and magnesium, 2 nutrients essential for nerve function and memory. In fact, long-term PPI users over 65 carry nearly a 45% higher risk of dementia, according to a German study of more than 70,000 seniors. If you've been faithfully taking that daily pill for years, it may be starving your brain of the very building blocks it needs. Antipsychotic medications, including risperidone, Risperdal, olanzapine, Zyprexa, and quetiapine, Seroquel, commonly prescribed for behavioral symptoms in dementia or for psychiatric diagnoses, are a particularly bitter irony. They calm agitation by blocking dopamine and serotonin, but in doing so, they dull the entire brain. The FDA even carries a black box warning against prescribing them to elderly dementia patients, citing an increased risk of death. Studies show they can accelerate cognitive decline in people with and without pre-existing dementia, leaving patients withdrawn, sedated, and at higher risk of sedation-related injuries from even simple tasks like standing up or turning in bed. Then there are the newer sleep aids, so-called Z drugs like Zolpidem, Ambien, Zaloplan, Sonata, and Esopicolone, Lunesta. Marketed as gentler alternatives to benzodiazepines, deep sleep and REM cycles, vital for memory consolidation, get truncated. Elderly users often wake up feeling groggy with impaired balance, and long-term use is associated with greater dementia risk and more frequent nighttime falls. Tricyclic antidepressants, older medications like amitriptyline, Elavil, or nortriptyline, Pamelor, are another hidden hazard. Their strong anticholinergic effects can cripple the same acetylcholine pathways we rely on for sharp thinking. In fact, one JAMA study found that every dose increase raises dementia risk, and patients who quit often see cognitive improvements. Yet these drugs remain in wide use for pain, depression, and insomnia. Similarly problematic are common bladder control medications, oxybutynin, ditropan, tolterodine, Detrol, and solifenacin, Vesicare. They too are potent anticholinergics, and studies link their chronic use to both structural brain changes and worse performance on memory tests. Older adults often remain on them for years, unaware that controlling their bladder might be sabotaging their brain. Statins, cholesterol-lowering drugs like atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, round out the list. Nearly half of all Americans over 60 are on one, often lifelong. While these medications prevent heart attacks, they also reduce the brain's supply of cholesterol, which is crucial for building and maintaining neurons. Many statin users report brain fog, forgetfulness, and difficulty concentrating, symptoms that often recede when they stop the drug. If you're taking a statin and noticing new memory lapses or mood changes, it's worth discussing alternative strategies with your doctor. Of all these offenders, the most dangerous are combination anticholinergic medications, those cough syrups, sleep aids, cold remedies, pain relievers, and gastrointestinal drugs that each carry their own anticholinergic load but get mixed into daily regimens. According to a 10-year Harvard study of more than 3,000 seniors, those with high cumulative anticholinergic exposure faced a 54% greater risk of dementia, even if they stopped the medications years earlier. This invisible cocktail is precisely the silent sabotage we must avoid. But it's not all doom and gloom. Science also points to powerful natural defenses, foods that actively protect your brain and slow, even prevent, cognitive decline. First among them are berries, blueberries, strawberries, and blackberries. These little fruits are rich in antioxidants called anthocyanins, which neutralize the free radicals that damage neurons. A Cincinnati study found that older adults consuming blueberry juice daily improved their memory and learning skills within just 3 months. Second, fatty fish like salmon, mackerel, and sardines supply DHA, a structural omega-3 fatty acid that composes a significant portion of your brain's gray matter. In research published in the Journal of Alzheimer's Disease, people who ate fish once a week lowered their Alzheimer's risk by 60% compared to those who never did. Finally, leafy greens, kale, spinach, and collard greens deserve top billing. Packed with vitamin K, lutein, and beta-carotene, they help maintain the integrity of brain cell membranes and promote anti-inflammatory pathways. Neurology research demonstrated that people eating 1 to 2 daily servings of leafy greens had cognitive abilities nearly 11 years younger than their non-leafy eating peers. If you're over 60 or caring for someone who is, here's what you need to do now. First, take an inventory of every pill in your medicine cabinet. Identify any anticholinergics, PPIs, benzodiazepines, statins, or sleep aids on your list. Then talk to a physician who specializes in geriatric care and ask if you can taper off or switch to safer alternatives. Chronic conditions may require medication, but often lower doses, non-drug therapies, or newer, less harmful drugs can achieve the same benefits without stealing your mental clarity. Second, enrich your diet with whole foods known to nourish the aging brain. Fresh berries, fatty fish, and leafy greens should become staples on your plate. Aim for at least 2 servings of fish per week, a handful of berries every day, and a big leafy green salad at lunch or dinner. Third, talk to your healthcare provider about nutrient status. Vitamins D and B12, magnesium, folate, and omega-3 levels are all important for preserving cognition. Simple blood tests can identify hidden deficiencies, and targeted supplementation can bring you back into the optimal range. Dementia doesn't have to be the tragic inevitability we once believed. By understanding which medications place your brain at risk And by filling your diet with foods that fight inflammation and oxidative damage, you can protect your memory, your independence, and your very sense of self. Now we'd love to hear from you. Have you ever suspected a medication was affecting your thinking? Which foods have you found most helpful for keeping your mind sharp? Share your stories and questions in the comments below. And if you learned something new today, please give this video a thumbs up, subscribe, and hit the bell icon for more science-backed health insights. Your brain is counting on you. Let's give it the care it deserves.